Welcome to the deep dive. We are so thrilled to have you joining us today.
Absolutely. It's great to be here.
We spend a lot of time on this show exploring incredible scientific breakthroughs, fascinating historical events, complex societal trends. But today we are tackling a subject that affects millions of people worldwide, yet it is almost entirely shrouded in silence.
Silence, secrecy, and
And frankly, a whole lot of unnecessary shame.
yeah, way too much shame.
Today, we are stripping away the taboo to look at the incredibly fascinating, slightly sneaky biology behind one of the most common skin conditions on the planet, which is genital warts.
It's a really important topic.
It is. And our roadmap for this journey is a comprehensive, highly detailed clinical and lifestyle guide written by Nikki Chase from Air Organics. Our mission for you today is simple. We want to replace the fear and the social stigma with hard biological facts and actionable knowledge.
And it's a mission I am very much looking forward to. When you look at the medical data, what stands out immediately is the massive disconnect.
Yeah.
We have a society treating this condition like a scarlet letter, when biologically speaking, it is essentially a temporary skin glitch. The reality is surprisingly manageable. So this deep dive is entirely about separating fact from fear. We are going to look at exactly how this virus operates, how it interacts with your body, and why understanding the mechanics of it is the ultimate antidote to anxiety.
Okay, let's unpack this. Because to understand the condition, we have to look right at the specific viral villains responsible for it. I was reading through the clinical data in the guide, and it mentions the human papillomavirus, universally known as HPV.
Yes, very well known.
Now, apparently HPV is actually a massive family of viruses. The guide notes there are about 40 different types that specifically infect the genital area. So does that mean any of those 40 strains can cause these growths? Or are we looking at a few specific culprits?
It is a much narrower field than people assume. The vast majority of genital warts are caused by just two very specific strains.
Just two?
It's just two, HPV-6 and HPV-11. And this is the most crucial piece of information to grasp right out of the gate. These two strains are classified as low risk.
Low risk meaning?
Meaning that while they cause these physical growths, they do not cause cancer.
Wow, okay. That is a huge distinction.
Huge. They are not the strains associated with cervical or anal cancer. They operate on a completely different biological objective than the high-risk cancer-causing strains.
So we're dealing with a highly prevalent virus.
Exactly.
I think public health experts acknowledge HPV is the most common sexually transmitted infection in the world.
By far.
But the specific strains causing these bumps are benign. So how are they actually establishing themselves in the body? Do they just wash over the skin and start growing?
What's fascinating here is how these specific low-risk strains execute what is essentially a highly coordinated cellular break-in.
A break-in.
Yeah, they cannot just penetrate healthy, intact skin.
Mm-hmm.
The virus actively looks for a weak point, specifically microtears in the skin or the mucous membrane.
Oh, interesting.
These are tiny microscopic abrasions that easily occur during normal friction, like sexual contact.
It really is like a microscopic heist.
It really is.
Once the virus finds one of those tiny micro tears, it slips past the outer defenses and dives deep down into what the medical field calls the basal layer of the epithelium.
Exactly.
And for anyone wondering, the epithelium is basically the foundational base layer of your skin tissue where new cells are born. So the virus completely bypasses your body's initial immune response and sets up camp down there.
Right at the foundation.
And once it's in, it literally hijacks the cell's internal machinery. It starts manipulating the normal cell cycle, forcing your skin cells to abnormally multiply and produce new viral particles instead of just doing their regular jobs.
And this hijacking process is rarely a fast one. The timeline is actually one of the most unpredictable aspects of the virus.
So?
Well, the incubation period, which is the time between when the virus enters that basal layer and when a visible growth actually appears, can be anywhere from 2 weeks to 18 months.
Wait, 18 months?
Yeah.
You could be carrying the virus and completely unaware of it for a year and a half before your body shows any physical signs.
Precisely. During that waiting game, the immune system is constantly trying to manage the viral load to prevent those visible growths from forming. It is a microscopic tug-of-war happening beneath the surface of the skin.
Which makes me think about other types of warts. We've all seen a common wart on someone's hand or elbow at some point. Is that the exact same biological process happening in the pelvic region? Like, if I touch a hand wart, Am I looking at the same virus?
They are fundamentally different, and the difference comes down to the specific viral strains and the physical environment they prefer.
Okay,
Common warts, the kind you see on hands, fingers, or elbows, are caused by completely different HPV strains, specifically types 1, 2, or 4.
got it.
They thrive on the tougher, thicker skin of the extremities, and they have a rough, almost grainy texture. Genital warts, driven by strains 6 and 11, are adapted to thrive in the delicate, sensitive tissue of the pelvic region. Visually, they are much softer and flesh-colored.
So the treatment approach has to be completely different then,
Night and day.
because you are dealing with highly sensitive tissue.
Yeah.
I imagine you can't just run to the pharmacy, grab that aggressive, over-the-counter, freeze-away stuff designed for a callous hand ward and use it down there.
Please do not do that.
Yeah, sounds painful.
Very. Treating delicate genital or mucosal tissue requires a totally different level of clinical care. Over-the-counter handwort treatments use highly concentrated acids that will cause severe chemical burns on sensitive pelvic skin.
Yikes.
Furthermore, common warts do not carry the social stigma or the sexual health implications. It is vital to clearly distinguish the two so that anyone dealing with this seeks the right kind of specialized, safe care.
Here's where it gets really interesting, especially when we talk about how this actually spreads from person to person. Because we are dealing with a virus that lives locally in the skin cells, transmission is strictly a matter of direct skin-to-skin contact.
Exactly.
The virus sheds from the surface of the skin, allowing it to move from one carrier to another during vaginal, anal, or oral sexual activity. And the guide emphasizes that it specifically thrives in moist, warm environments, which makes mucous membranes highly susceptible.
And that reliance on direct skin-to-skin contact brings up a critical caveat regarding protective measures.
Love to hear it.
Condoms are widely promoted as the primary defense against sexually transmitted infections, and they absolutely do reduce the risk of many conditions, but they do not offer total protection against HPV.
Wait, really? Because we are practically conditioned to believe condoms are the ultimate impenetrable shield? How is the virus getting past latex?
The virus isn't getting past the latex, it is going around it.
Oh, I see.
The virus lives on the skin of the entire pelvic and anal region, much of which is simply not covered by a condom. The base of the penis, the scrotum, the vulva, the inner thighs, all of the skin can be actively shedding the virus, and all of it makes direct contact during intimacy.
And reading through Nikki Chase's guide, there is a term that really jumped out at me. Asymptomatic shedding. This seems to be the main reason the virus is so incredibly common.
Asymptomatic shedding is a massive factor. It means a person can actively shed the virus from their skin and spread it to a partner without ever having a visible bump, lesion, or symptom.
That's wild.
You can transmit it without having any idea that an infection even exists, and you can contract it from someone who looks perfectly healthy.
That drastically changes how we should view the risk. It means that even if you or your partner have no visible signs, you could still be carriers right now. It is a stark reminder of how stealthy this virus is.
Truly stealthy.
Now, the guide does mention some rare non-sexual routes of transmission, which are worth quickly highlighting just to be thorough. For instance, there is a rare risk of touching an active common wart and then immediately touching the genital area, transferring the virus from the hands to the pelvis.
Rare, but possible.
There is also the possibility of a mother passing the virus to her infant during childbirth if she has active lesions in the birth canal. And healthcare workers can occasionally face occupational exposure during medical procedures.
Those alternative routes are clinically significant, even if rare. They explain why a medical evaluation is sometimes necessary to determine the source of an infection in unusual circumstances. But returning to the primary presentation, the visual evolution of these growths is quite specific and often missed early on.
Yeah, in the very early stages, they are incredibly sneaky. We're talking about tiny, smooth, or slightly raised flesh-colored bumps that are less than 1 millimeter in diameter.
Barely visible.
They're so small they are completely missed by the naked eye, often mistaken for just a regular skin tag, a pimple, or a harmless ingrown hair from shaving. But as the virus replicates and the cells abnormally multiply, those single specks can grow and merge into larger clusters. And the classic description used in the medical field is that they begin to resemble the top of a cauliflower plant.
And because of the way the virus spreads across the skin, those lesions can manifest in a wide variety of locations. For men, they commonly appear on the penis shaft, the glands, the scrotum, or even inside the urethra.
Right.
For women, they can develop on the outer and inner lips of the vulva, internally along the vaginal walls, or directly on the surface of the cervix. For both, they can appear around or inside the anus, on the perineum, or on the inner thighs. They can even occur in the mouth and throat following oral contact.
The guide also points out that in many instances these growths are entirely painless. But physical location plays a huge role in how they actually feel day to day.
Absolutely.
If they are in areas of high friction, like the inner thighs rubbing together or around the vaginal opening during movement, they can cause intense itching, burning, and serious tenderness. Itching is super common because the virus actually irritates the nerve endings in the skin.
Yes, the irritation is very real.
And if someone scratches that itch, it can cause small micro tears, which leads to stinging, minor bleeding, and potentially spreads the viral particles further across the skin.
Which is why playing detective and getting an accurate diagnosis is the essential next step. Because these early lesions are so easily confused with regular skin variations, doctors employ some very specific, highly visual diagnostic tools.
I found the diagnostic process really fascinating. If the bumps are tiny or flat, a doctor will actually apply a weak acetic acid solution, which is basically a specialized medical vinegar, directly to the skin.
It sounds strange, but it works.
And like magic, the acid causes the virally infected tissue to turn bright white. It makes the infected areas immediately stand out from the surrounding healthy pink skin, so the doctor can clearly see the exact extent of the infection.
It is a brilliant clinical technique. Alongside visual inspection, healthcare providers will use internal exams like pap smears to detect any cellular changes on the cervix.
Right, covering all bases.
If a growth looks highly unusual or the diagnosis is uncertain, they might perform a biopsy, taking a tiny tissue sample to examine under a microscope. And importantly, they can utilize DNA testing for HPV.
To find the specific strain.
Exactly. This allows them to identify the exact genetic strain of the virus in your system, confirming that it is indeed a low-risk strain like 6 or 11, and conclusively ruling out the high-risk cancer-causing varieties.
Once that diagnosis is locked in, the arsenal of treatments available is surprisingly diverse. The guide details several topicals that a patient might apply at home or have applied in a clinic, and they all work differently.
Very differently.
There's podophile toxin, which physically destroys the wart tissue. There's imiquimod, which is a cream that doesn't actually attack the wart directly, but rather stimulates your own local immune system to attack the infected tissue.
That's a clever one.
Then there is trichloroacetic acid, or TCA, which is essentially a localized chemical peel applied by a doctor. And then there's an ointment called cinecatechins. I was reading the ingredients for this, and it is literally derived from green tea extract.
It is indeed.
When I read green tea extract, my first thought was, wait, can I just apply a used Lipton tea bag down there?
I can safely say a used tea bag will not yield the medical results you are looking for.
Good to know. Don't try that at home.
Please don't. The cinecatechins ointment is a highly concentrated, clinically synthesized botanical treatment. But the pharmacological variety is impressive, reflecting the different ways we can combat the abnormal cell growth.
Right.
When topical medications aren't sufficient, physical removal is the next line of defense. This includes cryotherapy, which is freezing the warts off with liquid nitrogen. It can involve electrocautery, which uses an electrical current to burn the tissue away. For large or highly persistent warts, surgical excision or precision laser therapy under specialist care becomes necessary.
And we have to talk about the financial reality of this because it is a significant factor for anyone seeking treatment. The clinical guide breaks down the estimated costs. Those topical treatments, even the green tea ones, can range anywhere from $100 to $300.
It adds up quickly.
And the surgical procedures are much more intensive, requiring local anesthesia and clinic time, running from $500 all the way up to $2,000.
This raises an important question. Given the cost, the potential discomfort of chemical peels on sensitive tissue, and the hassle of clinical visits, do these growths ever just go away on their own?
That's what everyone wants to know.
And the answer is yes. Because genital warts are fundamentally a viral infection, the human immune system is perfectly capable of naturally clearing the virus. Statistics show that in many cases, the body will naturally suppress the virus and clear the visible warts within 6 to 24 months without any medical intervention at all.
But waiting up to 2 full years is a long time, especially considering the virus remains highly contagious that entire time, and you run the risk of the warts growing larger or spreading to other areas.
That is exactly why medical intervention is usually preferred. With consistent medical treatment, the timeline for clearing the visible warts drops dramatically to about 3 to 4 months.
That's much better.
Surgical removal is even faster, offering immediate visual clearance, though the skin obviously needs a few weeks to fully heal from the procedure.
However, clearing the visible wart does not mean the story is over. Genital warts are notorious for making a comeback. And the reason for this goes right back to the biology of the virus.
Yes, the recurrence rate is high.
Think of the virus like a weed in your garden. The treatments we just discussed, the freezing, the creams, the lasers, they chop off the visible weed above the soil. They target the visible abnormal cell growth. But they do not immediately eliminate the underlying viral roots from your body. The viral particles can remain completely dormant in the healthy-looking skin immediately surrounding the original wart site.
Exactly.
So the virus is just hanging out, laying low under the surface. And the guide notes that it can reactivate and trigger new growth if the immune system experiences a drop in performance. Things like high systemic stress, excessive friction from tight clothing or sexual activity, or a generally weakened immune state can wake the virus back up.
They absolutely can.
They specifically highlight smoking as a major factor that increases the likelihood of warts returning after they've been removed, likely because smoking suppresses immune function and restricts blood flow to the skin. And this recurrence usually happens within a specific window, typically 3 to 6 months after the initial treatment session.
Managing this condition requires patience and the understanding that multiple rounds of therapy might be necessary. It is about keeping the viral activity suppressed and removing the visible growths until your immune system finally recognizes the virus and clears it entirely.
Okay, so if the physical treatments are that expensive, uncomfortable, and not even a guaranteed permanent fix, I'm thinking the best treatment is just not getting them at all. Is the vaccine our only real shield here?
The Gardasil 9 vaccine is by far the single most effective tool we have. This vaccine specifically targets 9 different types of HPV, including types 6 and 11, which, as we established, are responsible for 90% of genital wart cases.
That's incredible coverage.
It stimulates your immune system to produce antibodies before you are ever exposed. It is widely recommended for everyone up to age 26 and for specific adults up to age 45. Beyond the vaccine, prevention strategies involve limiting the number of sexual partners to decrease exposure and consistently using barrier protection.
And as we discussed earlier, condoms do not eliminate the risk because of the exposed skin, but they do significantly lower the overall probability of transmission. The lifestyle section of the guide also heavily highlights the critical role of your baseline health. Maintaining strong immune function through balanced nutrition, adequate sleep, and managing your daily stress directly empowers your body to suppress viral activity before it can even form a visible bump.
If we connect this to the bigger picture, we hit upon the most crucial takeaway for anyone dealing with this condition. Genital warts are not dangerous.
Let's underscore that.
Let me emphasize it again. They are caused by low-risk strains. They do not cause cancer. They are benign growths. They do not affect your lifespan or your internal organs. The medical danger is incredibly low.
But the psychological toll is incredibly high. The guide goes deep into how this affects sexual health and mental well-being, and frankly, this seems like the real burden of the condition. Finding a mysterious growth in your genital area triggers an immediate, intense panic.
Understandably so.
People immediately jump on Google, fall down a rabbit hole of worst-case scenarios, and experience a massive loss of self-esteem.
The mental loop is exhausting. Patients worry about the deep, lingering social stigma associated with sexually transmitted infections. It often causes a total crash in libido. Many people avoid sexual intimacy entirely, withdrawing from their partners out of a paralyzing fear of transmitting the virus.
And then there's the stress of disclosure. Having to sit down with a new partner and explain that you carry a highly stigmatized, visually unappealing skin condition creates a massive barrier to trust and communication. People feel like they are carrying a dirty secret, when in reality they're dealing with a microscopic stowaway that most of the sexually active population will encounter at some point in their lives.
It is a profound psychological burden for a condition that is, biologically speaking, a benign skin anomaly. By understanding the science, by knowing exactly how common this virus is, how it utilizes asymptomatic shedding, and the fact that it poses no severe threat to your life, we can begin to dismantle that stigma.
Which is so needed.
Education normalizes the experience. It takes the condition out of the shadows of shame and places it firmly in the light of routine, manageable medical care.
So what does this all mean? If we distill everything we've explored today from Nikki Chase's comprehensive guide, it comes down to this. Genital warts are an incredibly common, sneaky, but highly manageable skin condition. They are caused by very specific, non-cancerous strains of the human papillomavirus that operate by temporarily hijacking the basal layer of your skin.
That's right.
Yes, they require direct skin-to-skin contact to spread, and yes, they can be persistent weeds in the garden, often requiring varied treatments ranging from immune-boosting creams to minor physical removal.
But more importantly, understanding the actual biology replaces fear with actionable knowledge. Knowing that your immune system is fully equipped to naturally clear this virus in 6 to 24 months, and knowing that the visible symptoms are a temporary benign hurdle allows you to reclaim your confidence.
The stigma relies entirely on silence, ignorance, and a lack of context. But once you shine a spotlight on the actual mechanics of the virus, it completely loses its power to intimidate.
It certainly does, and it leaves us with an interesting final thought to mull over. We spend so much time and money worrying about complex medical interventions and chemical peels, but the clinical data continually circles back to the power of our own baseline health. If our own immune systems are capable of naturally clearing this highly stigmatized, incredibly persistent virus within 2 years just by maintaining basic health, it makes you wonder, is our greatest defense against the viruses we fear most actually just the daily, unglamorous work of managing our stress and prioritizing our sleep?
That is a phenomenal question to end on. Thank you so much for joining us for this deep dive. We hope you walk away feeling empowered, informed, and ready to look at health through a clearer, more factual lens. We will catch you on the next one. Take care of yourselves.